Why is it that the same medications are effective for both inattentive and hyperactive types ADHD? Both are caused by low dopamine. Why is it that they manifest so differently?
So you have the three different types of ADHD, the combined type, which is inattentive, hyperactive, impulsive type. You have just the primary inattentive type and the hyperactive impulsive type. They all respond to a psychostimulant. And yes, what you're doing is you're firing up the prefrontal cortex, which is underactive, and increasing dopamine levels in that area. But there are also other tracts in the brain that you're actually increasing dopamine levels in as well. Particularly in the midbrain and what they call the mesolimbic system, and that has a lot to do with what we call hedonic tone. What if you're generally happy, sad, that type of thing, not clinically depressed, but you're more negative than positive, that type of thing. So these medications, it's not just simply the prefrontal cortex. There are other areas of the brain that are impacted by treatment. And but what we do know is that for all types of the disorder, they do respond to psychostimulants, and that efficacy applies over all classes of ADHD, of the effect size of 0.9 to 1.1 type of thing.
Right. So what you're saying is because ADHD has to do with the prefrontal cortex,
yeah,
regardless of presentation,
yeah,
that we have medications that help stimulate that area, it's going to help.
Yeah. Well, what it does is they block the dopamine transport system, the reuptake system, and so it increases the amount of dopamine in the synapse in the brain. The other thing is that the amphetamine class also will stimulate the release of dopamine as well. So, but then again, noradrenaline is also factored into as a neurotransmitter with ADHD too. And so that's, the most important thing is that you have to, we can sort of understand the neurochemistry, and that's, I think it's very important to do that, but it's important to understand your patient and to really I think what's most important in this whole process, and we talked about it yesterday, is that to have the patient become a student of this, to really understand what you're trying to do. And before I begin treatment with all patients, I hand patients out the CADRA medication list of all the medications and dosage ranges for these medications across the lifespan that we have in Canada today. And so going through that massive list and why we choose what we choose. And if it doesn't work, then what the next step down option might be. And so I think going into this, I think another big thing that, as a parent, to medicate your child with psychoactive medication, that is a huge hoop for parents to jump through. And I think you never want to get into a power struggle with prescribing. All that you want to do is to educate and just get them to understand the neurobiological basis to the disorder and what we're trying to do with our medical management. Similarly, if you have an underactive thyroid, what we do is we treat you with thyroid replacement therapy to normalize your function. Similarly, with ADHD, what we're trying to do is normalize neurochemistry in the brain and function.